Okay, so here we are, post-op day 0. Surgery was finished around 1 o'clock, 2 o'clock, sometime earlier in the day. We did abdominoplasty, reconstructing the entire abdomen, putting the muscles back together, all those things that we talked about, and a breast lift at the same time. And now it's around 5 o'clock, so about 4.5 hours afterwards. We're in the aftercare facility. What's your pain on a scale of 0 to 10?
I'd say about a 1.
About a 1, okay. And you saw the videos of the other women. Did you think it was going to be like this? Honestly.
No.
No. Yeah, it's kind of unbelievable, right?
I thought it was like a too good to be true.
Too good to be true. That's what
Yeah.
I hear every time. Is this too good to be true? But truthfully, it's about where you're at. Yeah, and that's because of the medications that we inject, but also the medications that we give before, during, and after. Have you taken any medication since you got here?
Just like 10 minutes ago.
A pill or a shot?
A pill.
Okay, so 1 pill or 2 pills?
1.
1 pill, exactly. So most patients, by 3 to 5 days, take about 5 to 7 total pills, total narcotics.
That's crazy.
I know, it's crazy, right? This is totally the average of what 99% of patients in my practice look like. Comfortable, they're not crying, they're not in pain, they're tight on the inside. When you get out of bed, you need help walking around stuff just to make sure that you can deal with that new tightness. But this should be your expectation of the next 5 to 7 days.
Oh.
Tomorrow, when you come to the office, when you get in and out of the car, it'll be a little tough because it's tight. And you'll be a little sore because you're just in general going to be swollen and kind of feeling a little out of sorts because your body's been through a lot. But this is totally par for the course.
Sounds good.
Yeah. And looking back on the fear that you had before surgery about pain, do you feel like we lived up to the expectations of lower pain after surgery?
Yes, absolutely.
Good. Okay. Well, I'm going to check back in a few days just because with patients, I always check back at 1 day, 1 week, 4 to 6 weeks, 3 months to see what their total pain has been like. And I'm actually writing a research article now where I'm looking back at all the patients that I've done since January is 90-something patients, just looking at their pain, and they're all about the same as you. So,
Nice.
what questions do you have for me?
Will there be more pain
After the numbing stuff wears off?
Days?
No, it's usually around day 5 that stuff goes away, but there's no drop off. It's not like patients are all of a sudden like, oh my gosh, it hurts now. If you don't feel pain right after surgery, the first 72 hours, the inflammatory pathways go down, things heal, your body really gets past the critical window where pain is actually being created, and most patients are great. So, and it's probably because of the fact that we treat it so well before surgery and in the immediate period after, but and we know this from other surgeries. Like if we treat that acute window well, then patients are usually really good later on. So it's all good news.
Good news, yeah.
So we'll check back again later, but at this point at least,